Part 40, Relief of Choking in Children. Welcome to the lesson on relief of choking in children. In this video, we will discuss the steps of the abdominal thrusts. How to relief of choking in children. Step 1, ask them if they are choking and tell them that you will help. Step 2, stand behind the child and wrap your arms around their body right below the rib cage. Step 3, make a fist with one hand and place it just above the navel. Step 4, grab the fist with your other hand and deliver quick upward thrusts. Step 5, continue performing thrusts until the obstruction comes out and breathing is possible, coughing or speaking is restored, or until the child stops responding. If you can see a foreign object in the child's mouth and can easily remove it, then do so. Avoid blindly sweeping the mouth with a finger, as it may push the object deeper into the airway. Continue CPR until the child recovers or until additional help arrives. Large children may require chest thrusts if you cannot wrap your arms fully around their waist. In this case, perform the Heimlich maneuver with your on the breastbone. Any child who has had a severe choking event should see a doctor. If the child stops responding, lay them down and yell for help. Check for breathing and begin CPR. After 30 compressions for one provider, and 15 compressions for two providers, open the airway and look for a foreign object. If visible, remove it. Attempt to give a breath. Continue CPR until the child recovers or more advanced help arrives. This concludes our lesson on relief of choking in children. Next we will review Introduction to Infant CPR.